Okay, great. Dr. Langer, thank you very much for joining us. I want to start just by understanding a little bit about Engender Health. So could you tell us about your work and your organization?
Sure. Engender Health was established 62 years ago, and over the first decades of existence, Engender Health mostly focused on voluntary contraception. Since the early 90s, we expanded our work to embrace all issues encompassed in the broad definition of sexual and reproductive health. We work internationally. Our headquarters are in New York City, but we have offices in 19 countries and work in more than 40. We strengthen health systems and health services. We provide training. We have a strong focus on quality improvement, and we also work at the community level and on the environment, trying to make it more enabling through advocacy efforts.
From an NGO perspective, what are your impressions of this report?
Well, this is a very, very useful report, a report that we really needed, a report that will help us articulate the reasons why sexual and reproductive health are at the core of the MDGs. Unfortunately, and probably due to political reasons, the MDGs don't mention sexual and reproductive health as such. Sexual and reproductive health are all over the place, but still they are not mentioned. And because the MDGs have been so instrumental for decision making about giving and about national policies, sexual and reproductive health is disappearing a little from both the international and the national agendas. And we need now to make proactive efforts to bring it back to the table.
You mentioned in your remarks specifically that since Cairo, reproductive health has been losing ground, losing visibility. Just refer to that again. What do you mean specifically since Cairo? And is that as a result of the politicization, do you think?
Yes, Cairo is a way to refer to the International Conference of Population and Development that took place in Cairo in 1994, at which 179 countries signed on a program of action that was expected to ensure access to sexual and reproductive health services for all by 2015. And after Cairo, there was this big momentum. All donors were giving money towards those goals. All national, well, not all, but most national programs were redefining their priorities to reach those goals. And unfortunately, over the years, there was this sense that population is not an important issue anymore, that particularly growth doesn't mean a threat for the international community and for national communities either. And that, the political environment also changed so radically here in the US, which is the main donor for international programs, that sexual and reproductive health is disappearing from many fora where it should be. So the fact that the MDGs don't mention sexual and reproductive health either contributes to that invisibility. And again, we need to be now very proactive and focus on making the links between the Cairo agenda and the MDGs clear. And the report strongly contributes to that, both with data and very well-funded arguments.
Thank you very much.
Thank you.
Stan, thank you very much for joining us. Can you tell us just a little bit about the work that's led up to this report and where it fits in the Millennium Development Goal process?
Sure. The UN Millennium Project was commissioned by the Secretary General and by the administrator of UNDP to put together panels of experts to give recommendations on what would be needed to accelerate progress for attainment of the Millennium Development Goals. Last year, there were 17 task force reports on selected areas related to the Millennium Development Goals. This year, there are 2 additional reports to address key omissions in the policy dialogue, one of them being the area of sexual and reproductive health, which is the topic of this report, and a later report on energy needs.
The report is provocatively titled. Can you explain the sort of thematic development and why the report is titled the way it is?
Okay, well, we titled the report Public Choices, Private Decisions to highlight the fact that people are responsible for making their decisions and their choices, that it's their lives that they want to influence and improve, it's their families that they want to help, but that these decisions don't take place in a vacuum. We're not just individuals, we're members of communities. The choices we make are affected by the kinds of public statements political leaders, cultural leaders make. And so these private decisions that will so strongly affect our ability to attain the MDGs are shaped by the public choices, by the opportunities that our public systems and our public-private partnerships present.
In your remarks, you specifically said that the issues around sexual and reproductive health have been confused and politicized. Could you elaborate on that a little bit?
Well, you know, it's strange that one of the planet's strongest historical supporters of family planning programs, the United States, is at the moment somewhat ambivalent. They continue to provide more money for these services than other bilateral donors do. They are major contributors to HIV/AIDS, but at the same time, there's also a leeriness about dealing openly and honestly about issues of sexual and reproductive health. There's an uncertainty about what to do about such things that we highlight in the report as adolescent sexual behavior. The report agrees that you need a multiple approach. You need delay of onset of sexual behavior. You need protection for those who are actually engaged in it. What we feel the evidence shows is stick to the evidence. Test what works. Try it out in other places. Moralism in debate is not going to solve a public health problem.
The report is chock full of data, and from a public health perspective and good science, provable data. It is, as you said in your remarks, the data that informs world leaders, now available to everyone to see. How does that fit into the ideological debate? Do you believe that this sort of a report will help to address some of the ideological and moral concerns that have been out there?
Well, you also asked about the process that led up to this report. And during the time that we've been developing this report, we've also been involved in going around and monitoring what's happening in intergovernmental meetings. The World Summit last year, the World Health Assembly last year and this year, meetings in New Delhi on the Partnership for Maternal, Newborn, and Child Health, a variety of meetings in various places. And what we saw emerge, as the report says, from the summit outcome was a growing recognition that the governments of the world are behind universal access to reproductive health as a development strategy. That was included in the World Summit outcome, and now the next step is to get it into the follow-on resolutions, to get it translated into national policy statements and implemented in national programs.
What's the step moving forward? How does this report become implemented in the process?
Well, we expect that the current intergovernmental discussions that are taking place at the United Nations are going to endorse what the Millennium Project Task Force called for, a target on universal access to reproductive health.
And what are the costs associated with this program or try that again. What are the costs associated with implementing these goals?
Okay, well, for the payoff that you get, though the number sounds large, it's relatively small. There was an initial estimation of what the costs that would be required at ICPD, the International Conference on Population and Development, in 1994. This report presents new analyses that suggest that the cost would go from almost $19 billion a year now up to about $36 billion a year by 2015 for gradual and steady progress towards universal access to reproductive health.
Thank you very much.
Thank you.